morning to all of you. Before going into the presentation, I would like to say something. I'm not a physiotherapist, nor a radiographer. I'm from the Department of Nursing. But luckily, my presentation fell into this session. So most of the things were like great to me, but then again, of course, I learned a lot of things. So yeah, let's move on to the presentation. Today my topic is risk factors related to low back pain among female nurses at District General Hospital Chilaw and National Institute of Mental Health, Angoda. This is the overview of my presentation. Introduction, background, objectives, methodology, data analysis, results, conclusion and recommendations. Moving on to the introduction. Low back pain, as you all heard from the previous presenter, it's known as LBP, is defined as pain, muscle tension or stiffness, localized below the costal margin and above the inferior gluteal folds. So as in the picture, these are the two areas in between where we get low back pain. LBP is a major cause of disability which interferes in the quality of life, and according to the onset and duration of the pain, we could categorize it into three categories as acute back pain which persists for less than 6 weeks, subacute back pain which persists between 6 and 12 weeks, and chronic back pain which persists for more than 12 weeks. So in our study, we have only selected the female nurses who are suffering from chronic back pain. And also, it is a common condition and accounts for many reported disabilities among nurses. It has significant effects on the nurse's health and quality of patient care as well. Because, say, if a nurse is having a low back pain, it directly affects his or her patient care and her performances as well. Furthermore, the impact of low back pain on nurses results with reduced work time, increased risk of fatigue, and associated personal and institution cost reduction as well. So this is the background of the study. Low back pain among nurses has a high prevalence state in the world, as it is stated by Ajim Shah 2004, and also both developed and developing countries such as United States, Sweden, Egypt, Kenya, Korea, South Africa, and Sri Lanka have high rates for low back pain prevalence among nurses. And also, many factors are combined with low back pain among nurses, such as inappropriate work conditions, incorrect body positions such as bending, frequent rotations, and carrying heavy weights. And also some studies done by Bernard in 1997 has mentioned that environmental factors as well as physical activities in such conditions, exposing to daily routine activities, performing repetitive activities, weak abdominal muscles and muscle shortening give rise to low back pain. According to a study done in 2005 by Banpei et al., majority of the nurses have been identified to be suffering with low back pain due to long-term standing positions and inappropriate patients moving and lifting procedures. So these are the objectives of our study. Our main objective is to identify the risk factors related to low back pain among female nurses. So these are our specific objectives: to identify the personal factors related to low back pain among female nurses, to identify the psychological factors related to low back pain among female nurses, and to identify the work-related factors related to low back pain among female nurses. So I'll move on to the methodology. This is a quantitative, descriptive, cross-sectional study. The study setting. As the study setting, we selected 2 hospitals, the District General Hospital Chilaw and National Institute of Mental Health, Angoda, because all the 4 of our principal investigators are working at these hospitals. So according to the feasibility, we went for these hospitals. So the population and sample size, we selected 152 female nurses working at the above mentioned hospitals. Sampling method, non-probability convenient sampling. We went for convenient sampling according to the limited time duration, and this was an unfunding study. Sample size calculation. This is the equation we use to calculate the sample size. According to the recent study which was done in 2007 on the back pain prevalence among nurses, it has been found out that 10% of the nurses were suffering from low back pain. So in the equation N, as we all know, is the sample size, Z is 1.96, which is the critical value, and P, probability estimate of proportion, and D, 5% of acceptance level. So here we have done the math part, and sample size have come as 152.65, which has been rounded into 152. So these are our inclusion criteria. Female nurses between 20 to 60 years, we selected the age group as 20 to 60 years because from the previous studies we have found out that female who are between 20 to 60 years are more prone to have low back pain. And the nurses who had been experiencing the symptoms of low back pain for more than 12 weeks, who had already been diagnosed for low back pain by a rheumatologist. These are our exclusion criteria. History of systematic or localized neurological disorders, and the individuals who were not physically or psychologically fit enough at the time of data collection, and pregnant nurses were excluded, and also nurses who were less than 20 years and the retired ones were excluded. Ward or unit managers such as sisters and matrons and student nurses were excluded. And also the ones with fractures in spine, pelvis and the lower extremities, history of spinal or abdominal surgery within last year, hip or knee dysfunction and deformities were excluded, and also any disease related to genitourinary system were also excluded. The data collection tool was an interview-based pre-tested questionnaire with 10 nurses. And also content validity and face validity was established, consulting supervisor of the study, and the questionnaire was sent to the field experts, and the questionnaire was amended prior to data collection according to their comments and suggestions. Data analysis were using by the software, SPC software version 21. Ethical considerations, ethical approval for the study was obtained from the Ethics Review Committee of Colombo South Teaching Hospital, Kalugowila. The permission to collect data was obtained by the directors of the two hospitals, and also participants' informed written consent was taken from the participants, and voluntary participation was encouraged. Moving on to the results section, we have categorized results into 4 sections as demographic data and personal risk factors, psychological risk factors, and work-related risk factors. So on demographic data of the participants, the study sample consisted of Sinhalese 99.5, while 0.5 were Tamils, and 72 of the subjects were married, and 28 of them were unmarried. Highest proportion of them, around 75.5, were nursing diplomats, while the rest of the people had a special training relevant to working place. 3 categories as individual risk factors, psychological risk factors, and work-related risk factors were identified. This is the individual risk factors. We have identified 5 major categories under individual risk factors: age, marital status, number of children, and type of delivery, and BMI. Under age, we have found out that nurses between 41 to 50 years of age are more riskful to have low back pain, and also the ones who are married are more prone to get low back pain compared to the others. And also number of children who are between 1 to 2 are also more riskful and more prone to get low back pain, and also the ones who had undergone liposuction cesarean surgery were also more prone to get low back pain. And the ones with higher BMI, more than 24 kg per square meter, were also more prone to have low back pain. So this is a little discussion on the individual risk factors for low back pain. Hassan in 2004 has supported the fact as the mean age of the nurses who are working in operating theatres and suffering from low back pain was 34 years. And also Ansari et al. Had stated that the prevalence of low back pain among married female nurses was higher compared to unmarried nurses. Furthermore, his findings had supported that the fact that number of children has an inverse association with the low back pain among female nurses. since it takes a lot of time, I'm not going to read the whole thing. So these are the psychological risk factors. According to the current study, we have found out 2 psychological risk factors as heavy stress due to heavy workload and work-related and lack of social support. So these are the work-related risk factors. There also we have identified main 5 risk factors. Working at special units such as ICUs and operation theatres, and the ones who are having more than 6 night duties per month, and the ones inappropriate postures, and the ones who are having more than 30 hours per week. Likewise, so this is also another small discussion on work-related risk factors for low back pain. This is the conclusion of the risk factors. We have identified all the risk factors and the prevalence, percentage of the prevalence that is being accounted by each risk factor has been mentioned on the left side of the table. And most significantly associated 3 risk factors have been identified, and correlation coefficients expressed were found on them, and identified the p-value as well. So this is our conclusion. According to the findings, individual risk factors of low back pain among female nurses are age, marital status, having more than 1 children, obesity, and lower section cesarean surgery. As psychological risk factors, we have come up with work-related stress and less social support, and also having more than 6 night duties per week, working at special units, and the incorrect postures were identified as work-related risk factors. So as to recommendations, we would like to recommend the policymakers in implementation of new nursing practices, education and nursing work dedication, and also Nursing Education Authority has the responsibility to educate nursing students regarding maintenance of healthy body postures while doing their patient care well, as well as updating nurses' knowledge through in-service education sessions would make a big difference. This is the acknowledgement. I would like to thank both the directors of the hospitals and our supervisor, Mr. Chilaw, who is currently out of the country, and all the staff at the nursing department at Open University of Sri Lanka. These are my references.